I think we must not underestimate the imperialist. The imperialist did not stop his agenda. He just changed how. You see, they just changed how they would enslave the African. They just changed how they would colonize the African. And aid is one of the biggest ways that they still enslave us. There's no way that your jailer also has what's best for you in mind. No. So the big question, Nombo, is, can we truly have or claim to be independent when we cannot treat ourselves? Problem is, when you're not the solution to your own problems, you can easily be controlled. Now, remember, health is wealth.
Yeah.
You know, ask any man on the deathbed if he wants 2 million kwacha or 5 more years to live. I bet he would ask for 5 more years to live. Most people, when they begin medication, Western medication, they don't stop. One of the biggest mistakes that we have made in Africa is to look at anything traditional
and trash it.
And I want to tell you 4 mistakes that we make. Mistake number 1.
Good evening, Pastor Pemba.
Good evening, Noble. How are you doing today?
I'm great, sir. I'm great. Today, sir, we're talking about the state of healthcare in Zambia and in Africa. And I'd just like to start off there. What do you think about the state of our healthcare inside of Zambia?
A state or a nation, a people, no real government can claim to be serious if they do not prioritize the healthcare of the citizens. So Africa right now carries about a quarter of the world's disease burden, but has got such a small capacity to deal with those problems, right? When we talk about the quality of our hospitals across the continent, we talk about having essential medicines, we talk about specialist doctors, emergency care, mental health facilities and care. Generally speaking, our health systems do not match the disease burden that we have. So a lot of African problems right now have to do with
the healthcare itself.
The healthcare system itself. Exactly.
I saw a statistic from the World Health Organization talking about how there's only one doctor or one nurse per 10,000 Zambians.
I mean, that's precisely what the crisis is. The truth of the matter is that the cost of healthcare is high. Even for those that access the healthcare without paying a figure like 1,000, it's subsidized. In Zambia, we've got NEMA, which has really helped a lot. And those people that are on NEMA, you find that you cannot do this test. Let's say the doctor recommends you do 3 tests. They may tell you that, okay, for today, you can only do this specific test. The other one, you may have to pay cash or come back another time. Those are challenges that are there. And very few people can afford other kinds of medical insurance. When they go to government facilities and you want to do certain procedures, sometimes the waiting lists is very long. You know, sometimes you can be given an appointment for 6 months later. Obviously, the statistics that you have shared paint a very dim picture which is the state of our healthcare in Zambia, the state of our healthcare in Africa, that we have a long way to go to a point where the average African or the average Zambian can access medical care in a hassle-free way.
Yeah.
So it's a real problem.
Yeah. And from hearing such statistics and seeing the problem that we have, you'd think that the solution would just be to pump out more health professionals. But we see that in Zambia, say, we've got a lot of nurses graduating. We've got a lot of doctors.
And they're not being employed.
Yes, and
there's no place.
There's nowhere for them to go. So it seems that is not even the solution. So is there a deeper problem?
Of course. I mean, it's systemic. Just like any other problem in Zambia, just like every other problem in Africa. It's a systemic issue that must not be viewed from a political viewpoint. Neither must it be viewed from an emotional viewpoint. You first have to be able to tackle the system. You know, I like to talk about how Africans must sit down and make the system their own. Most of the systems that we're currently running on, whether it be healthcare, law enforcement, education, most of these systems are systems that we have inherited from the colonial masters. and we're trying our best to tweak them to make them work. But in the process, we're not getting anywhere, right? We're not getting to where we need to go. So we really need to come back and sit down with all the different stakeholders, different professionals, and say, what system will work for us? Redesign the system before you just start throwing healthcare professionals at the problem. Redesign the system, then you deal with education, then you deal with placement. This is not a one-year issue. This is a long-term issue that has to be dealt with.
So you started by talking about how can a nation truly be sovereign if we don't have our own healthcare system, or we don't own our own healthcare system. And we've seen that the solution, the temporal solution that has been put in place, is throwing aid at it. So
Right.
Is that a proper fix?
It's not a fix. And first of all, let me mention this. I think this is something important to be mentioned, that through USAID, PEPFAR, CEDA, the different aids, Global Fund, a lot of lives noble have been saved. We can't run away from that. The fact that aid has done its part in terms of saving lives. Over 1.3 million Zambians receive HIV treatment. So there's been a lot of improvement in terms of access to HIV treatment for Zambians, right? So over 1.3 million Zambians receive HIV treatment. However, a significant portion of that HIV treatment is funded or has been funded by Global Fund and PEPFAR. As of 2025, 42% of our ARVs was purchased through PEPFAR. So, wow, thank God that people's lives are being saved. But the problem is, when you're not the solution to your own problems, you can easily be controlled. Now, remember, health is wealth. Ask any man on the deathbed if he wants 2 million kwacha or 5 more years to live. I bet he would ask for 5 more years to live. Right? Because life itself makes no sense if you are not healthy. But when your health system, your health procedures, the funding, everything is dependent on foreign aid or on foreign systems or on foreign research or on foreign food or on foreign ideas, what happens to you is that you cannot truly say you are sovereign. You can easily be toppled over. You can easily be manipulated. You can easily be pushed aside. Now, the question is this: what happens if the donors change their priority? What happens tomorrow if the donors say,
don't want to do this anymore? I mean, we've already seen Trump pull such moves before.
There's been a lot of talk about America saying, look, we can continue to partner with you in the funding of these things, but we want mining rights, but we want data, blood samples, and stuff like that. To do what with it? I'll give you a very unpopular opinion. Does that make America bad? Does that make Donald Trump bad? Of course not. Donald Trump is the president of the United States of America. He's got a mandate. And his mandate is to represent the interests of America. Donald Trump is not the president of the world. Therefore, the interest of Africans and the interest of Zambia, he's got nothing to do with it. It's our leaders in Africa, our leaders in Zambia, that have got to stand up for what we stand for. And I mean, I must pay kudos and respect to the government of Zambia and the president, HH, who rejected that deal, right? Unlike some other countries in Africa that bowed to that deal. And it takes an immense level. And I'm not talking like this because I'm a supporter of, I'm not talking as a supporter of HH or a supporter of any political party. I'm just recognizing something right when it's done. It takes a certain amount of courage to say no to a bully. Because United States of America is a bully. Donald Trump is a bully. To say no to a bully for the sake of your own people, that takes courage. And that's what Africans need to do. But the issue is, what happens if they pull the plug?
That's the follow-up question, because what we like to say is, let them get their own things and we'll build our own. But then what happens when they put
They put the plug. Then we suffer. The politics and the African and the revolutionaries of our generation. No, but the revolutionary of our generation does not need to be the same. We don't need to have the same energy as the revolutionaries of the 60s, the 70s, the 80s. Right? So in that time, it was required for the revolutionaries to be very aggressive and say, down with this and down with that, to hell with this, to hell with that, right? Down with oppressed. But the revolutionary of this generation has got to be more strategic, more intelligent, more calculating. We have to build systems underneath our rhetoric. Because one of the things that we understand and learn is when you fight against the system and that system walks away and you haven't built good systems for it, you end up in a crisis. What we need to think about more than what would matter more is not just saying no to America. Just what will matter more is not going on podcasts and just talking about how we need to end aid. Aid is bad for Africa. Okay. What alternative system do you need to build? Let's build those systems. Let's build our own healthcare. Let's build our own platforms. Let's empower our own people so that we can confidently say no. The only reason these threats cannot be held against places like China or India is because they have taken time to build their own systems. So the big question, Nombo, is, can we truly have or claim to be independent when we cannot treat ourselves? How can a nation or nations that produce copper, gold, diamonds, oil, the wealthiest nations in the world in terms of rare earth metals, we are literally in the palms of those that we claim oppress us. We are at their mercy. So we tell them, away with you, imperialist, get out. But then we turn around and say, oh, but by the way, we need your help. We need medicine for our babies. We need medicine for our people with AIDS. It can't work. We have to be more intentional.
On that, do you think aid, more than, of course, it's helped us and it's been very helpful for all of the nations in Africa, but do you think it's also been a tool that has been used to stop us from developing, or is that just based on ourselves and failing to develop systems in our healthcare?
No, I think we must not underestimate the imperialist. The imperialist did not stop his agenda. He just changed how. You see, they just changed how they would enslave the African. They just changed how they would colonize the African. And aid is one of the biggest ways that they still enslave us. Because aid builds dependency.
Yes.
And they know that the more you are dependent upon them, the more they can dictate. So they will tell you, we're giving you this aid, but this aid comes with ABCD conditions. And these conditions have always been there. It's just that now with Trump, it's more overt.
Yeah.
And the demands are quite high, but the demands have always been there. And this is not just aid in the area of healthcare. This is just aid in general for anything. It's a tool for colonization. It's a tool for imperialism. Also a tool that is used to make us not productive. Because then you have a huge number of our workforce. There seems to be money in the economy. It's people buying houses and building. But a lot of that money is coming from people working for NGOs. And there's nothing wrong with that. But the point is that when our economy is running and sustained and energized by humanitarian work, then we're not actually producing anything in the first place, right? So anyone who pulls that out can shake. And we saw what happened when USA pulled out, when PEPFAR pulled, when all these things began to pull out. On a very local level, families shook. on a very local level, apart from the recipients of the aid, obviously
Yeah.
being affected, but even those who are working
Well,
for these
for this, these NGO.
NGOs, they shook. And I mean, people had Range Rovers, Land Rovers, Hiluxes, all sorts of things, big houses. But based on that, and I'm not against them having good jobs, you know, may they have more. But my point is, you cannot build a country on aid. There's no country in the world that has developed on the basis of aid. You develop on the basis of industrialization. You create value so that you can create more opportunities and jobs for the people. You can export and have more forex. You have to do business. You have to produce something. You can't be dependent on somebody else. Now, when that somebody else changes their mind or has a new agenda, you're always going to be at their mercy.
So you're talking about dependency and how we should have the capacity to produce our own things in the first place, because if we don't, we're at their mercy. And just looking back at things, at wisdom that we already have as Africans in our country, we're looking back at traditional medicines and indigenous knowledge that we have. Is there anything that can be done from there?
I think it's possible, right? Obviously, I'm not a medical doctor, but here's my point. Something can be learned from the Chinese.
Yeah.
The Chinese found a way of fusing their ancient knowledge with Western medicine. One of the biggest mistakes that we have made in Africa is to look at anything traditional
and trash it.
And I want to tell you 4 mistakes that we make. Mistake number 1. Mistake number 1 is we look at any traditional cultural medication as witchcraft. That's the problem. You see?
Yeah.
Now, African medicine does not have to mean witchcraft. Growing in Africa, they would have told you that if you get aloe vera, right?
Yes.
Aloe vera, you have a rash on your skin, you put some aloe vera, you get healed. You boil aloe vera, you drink it, to deal with some issues in your body. Right?
Yes.
We trash that and say, no, this is traditional things. They don't make sense. And then the Westerners went and did research on aloe vera and came back and told us it's good for you. They put it in lotions, they put it in teas, special aloe teas, and this and that and that. And now we go back and we buy it.
Yeah.
So there are certain things that we have here, certain foods, certain roots, certain tubers that are in Africa that Africans have passed on from generation to generation that help people live long. I'm saying that Africans and African governments would do well to not bow to everything that Big Pharma says and actually permit for research. Now, I'm not calling for us to abandon Western medication, because I think that, by the way, out of the all the terrible things that came from the West, one good thing that they have is the
medication.
their medication
Saved us from malaria.
Exactly. Yes. Western medicine and Western medication is very progressive. That we need to adapt and learn. I mean, it's really improved the life expectancy. Research has showed that. But I'm saying that African governments and Africans can be deliberate to invest research in African remedies, see their efficacy, do clinical trials, and perhaps we could be sitting on a lot of cures that we may not even be aware of. Look what the Koreans are doing with ginseng. We can do it ourselves. So mistake number 1 is to think that everything traditional is witchcraft. No, it's not. Right? There's roots, there's fruits, there's juices that are here. But number 2, a mistake people make with African medicine is on another side, the other side of it. Right? We love to give all sides of the picture. The other big mistake people make with African medicine is to think that all African medicines are scientifically proven. So someone will say, I'm not taking any penicillin. No, I will not take this antibiotic because my grandmother gave me this concoction and I'm telling you it works. If you drink 3 cups of this, it works. Right? It's not scientifically proven. And we need to elevate African remedies and African solutions from being grandma's mix to actual
taking clinical trials and everything.
Let's do clinical trials. Let's do the work. Let's get our university. What are our universities for? Mistake number 3 when it comes to traditional medicine is we think that all Western medicine is bad. It's true that pharmaceutical industry is a huge industry.
Yeah.
It's true that pharmaceutical industry does not aim to cure.
It aims to make money.
It aims to make money. So they want you to be a recurring client. Most people, when they begin medication, Western medication, they don't stop. Very few people do you know who start taking something and they say 2 months later, I'm done.
I'm done, yeah.
No.
Continue taking
You continue taking it. You speak to diabetes patients, all these patients. You're always taking it for something, and then you're taking this medication and it affects your liver. Then you begin to take something for that and it affects. There's always that they want you to always be paying. It's built on that. But at the same time, Western medication has been very positive for the health of people. We can learn from it. We can do like India. India built their pharmaceutical industry over 20 years. And now India is the number 1 producer of pharmaceuticals in the world. They're reliable. They're the best. And what did they do? They got all this medicine. They got scientists around it. They got researchers around it. And they say, discover what's in this thing and find out if we can produce it for ourselves at a cheaper rate that our people can afford and that we can export. You have to be that crazy. You can't be waiting for a pat on the head by the white man. You have to just do what you need to do to heal your people and to make money. And not just plans, foreign plans building in Africa. No, I'm talking about the governments of Africa deliberately empowering local people, getting capital, pumping it in, getting finances, pumping it in, empowering our scholars, getting foreign scholars to come and share their expertise. We can begin to produce our own medications, especially for the ones that we need on a constant and regular basis.
Yeah.
Especially for something like ARVs, which we have been taking for a longest period of time. All this time, somebody could have gotten samples and figured out what's in it and how do we produce it. And that can become such a huge place for exports.
Yeah, even just in different developing African countries, because now they don't have to then depend on Western power.
Exactly.
They can get it from us.
They can get it from us. One thing that we cannot ignore is for there to be a good health policy in any country. It's beyond how the hospitals look, how the doctors look, how the nurses look. That's important. But it must also include eating. There must be a deliberate plan by every African state to ensure that the nutrition in that country is well taken care of. Because if the eating in a country is poor, everything collapses. The healthcare system will collapse because you have more diseases. The education will collapse because children are not understanding what they're learning. Their brain development is broken. The growth of children, physical growth, they become stunted. So when we talk about health sovereignty, it must also deal with issues of nutrition and food security. These issues cannot be negotiated.
So you're talking about stunting, and let me just pull up some stats from the WHO. Showing that 32% of under 5 children suffer from stunting, and 12% of under 5 children in Zambia are actually chronically underweight. As well as when we speak about anemia, 58% of under 5 children in Zambia are anemic. And all of these are talking about the nutrition, how children are eating. So just reiterating the importance of nutrition, like you said.
Exactly. 58% is an alarming figure. Our children are not well fed. We are not well fed. This country is not well fed. This continent is not well fed. And our fixing of our health situation must begin with the nutrition. But here's the problem. We have so much land, but we have got hunger. How? I'm not trying to be a conspiracy theorist, but there's a time when you could plant seed. Your great-grandmother, your grandmother could probably plant seed. Keep some of that seed to herself so that she can use it to plant again. That doesn't happen. New variety of seeds. Once you plant it, it's the end. You must go and buy. Now remember that this is the problem with the capitalist system. So The healthcare system is designed around money. You must continuously be buying medicines. For you to see good medical care, you must spend. It's all centered around money. And they know that a nation that eats well is healthy.
Yeah.
So how do we keep you sick so that you are constantly coming back to buy our medicine? Let's give you food that will kill you. In the book of Genesis, Noble, he spoke about how each plant had seed in it. And the idea of God is that, you must be able to eat plant. But now you have got to buy the seed. And once you harvest it, you can't plant it again. You must buy again. We're eating GMOs. We're eating chemicals. We're eating processed foods. Even those who are not in the malnutrition case, the richer guys are eating chemicals, and they're good, their diabetes and their cancer. So on one side, you've got the lifestyle disease, the cancers, the diabetes. On the other side, you've got the anemic and the malnutrition. It's the same thing that is being done. Everyone is still landing up in a place where they're unhealthy. When you analyze it well and you discover that 45 African nations import fertilizer, how can 45 countries be importing fertilizer, most of it from countries like Russia, countries where there's no proper land, agricultural land? We're buying chemicals and putting in our soil, making the soil dependent
On the
chemicals, basically polluting the ground. Most of the countries in Africa have got, fertile soil, good rainfall, good conditions that their crops and whatever their fruits can grow. But we are constantly dependent on these people, and we don't even do our own research. So definitely we are seeing an issue based on the statistics that you have shared, that there's a real food problem. Africans had food, right? Long before these problems began, Africans had food.
Yeah.
Africans had African foods. But we are abandoning our African foods. That's why we are dying of hunger. Research was done, Noble, and they discovered that when they took young men and they put them on African diets, inflammation reduced in these African men, right? Inflammation reduced, their health developed as compared to when they were on Western style foods. But because we are not focused on our foods, the foods that grow well naturally in our soil, we're not focused on those things. We would rather set ourselves up in a begging mode. We're not thinking of our own solutions. So therefore, our health comes back in problems. These processed foods, processed drinks, it's killing us. The amount of sugar we take, the amount of sugar in our drinks, it's murdering. And if we don't sit back and begin to regulate stuff, there has to be a lot of regulation on self as Africans. What do I eat? It must begin with the individual. How am I eating? Our governments must be very strict as to what foods do people eat. What's on the shelf? That's why we've got things like Bureau of Standards. But I don't know if they're really doing their job, because there's a lot of chemicals, there's a lot of sugars, there's a lot of things that people are consuming that is killing this generation day by day. And aside from that, there must also be strong policy, Noble, very strong policy in ensuring that children in rural areas, children in the statistics that you have mentioned, have access to good food, to balanced diets. That's where it really begins, because if you can have a well-fed society and an educated society, you're bound to have a productive society. Those two things must definitely come together.
What does the future look like then? What steps can we take now? This is a problem that, like you said, it's not a one-year project. It's we looked at India, and it was a project over decades for them to get to a point where they were actually capitalizing on what they were sitting on. And we've talked about, our own remedies, our own foods, and things like that. And we might be sitting on a gold mine. So what do we do now? The young generation listening to this, the people in government, what steps do we take towards a bright Africa?
I think the first thing that we all need to do, Christians, Africans, well-meaning human beings, is we need to depoliticize health.
Mm.
We need to depoliticize development. We need to all agree that we want Africa to move forward. We may see things different from different points of view politically, but at least let us agree that we need this thing here to be a non-political issue. That regardless of what political party wins any election in any part of Africa, this issue of healthcare and nutrition must be a non-negotiable priority, number one. Number two, we must begin to ask questions that put us in a position where we can find our own solution. Let's not wait for the research, the statistics, the production, the instruction that comes from those that enslaved and imprisoned us once upon a time. There's no way that your jailer also has what's best for you in mind. No. We have universities, we have intellectuals, we have got governments. Let's have political will to begin researching into our own drugs, to begin our own public health data collection and research. How do we respond? What foods work for us? What foods don't work for us? You know, what food should we really be eating? We can't depend on somebody else's research. Let's do our own research and discover what works for Africa.
So does this mean a change or a slight adjustment to our education system? Because like we've said in previous episodes, we're producing more people who are not, like you said, the researchers who go and research. We're producing the people who sit at the desk and do that.
Exactly. The problem is we have diploma mills. We're producing people who can get a job. But we need to change the conversation at university level. We need to change the conversation in the senior secondary level and begin to provoke the young mind in Africa to say, you can come up with a solution. You can shape what our food looks like in the future. The people can come up with solutions that begin to transform the nations. And the moment that education comes into the people's minds, boom, we'll see our nutrition, we'll see our healthcare, we'll see our politics, we'll see our industry change. What we need is a change of conversation. So let me end with this statement that a nation that cannot take care of the health of its people cannot control its future. So for Africa to be truly sovereign, for African states to be truly sovereign, for African people to have dignity, we have to make sure that we are engaged in building strong and sustainable healthcare systems.